Hello and welcome. Today, we're going to explore an important logical concept that frequently arises in the field of applied behavior analysis and in everyday reasoning, the fallacy known as affirmation of the consequent. Understanding this fallacy will enhance your ability to critically evaluate cause and effect claims and improve the effectiveness of your interventions. And later, let's apply what we've learned with a mock scenario. What is affirmation of the consequent? In Cooper book, it says a three-step form of reasoning that begins with a true antecedent consequent if A then B statement and proceeds as follows: 1. If A is true, then B is true. 2. B is found to be true. 3. Therefore, A is true. Although other factors could be responsible for the truthfulness of A sound experiment affirms several if A, then B possibilities, each one reducing the likelihood of factors other than the independent variable being responsible for the observed changes in behavior. Affirmation of the consequent is a logical fallacy in the form of a formal fallacy. In a conditional statement, which is typically expressed as if P, then Q, affirmation of the consequent occurs when one argues that because Q is true, P must also be true. However, this reasoning is fallacious because Q being true does not necessarily mean that P is the only reason for Q. The correct logical form to affirm a conditional statement would be to affirm the antecedent if P, then Q. P is true, therefore, Q is true. Affirmation of the consequent, on the other hand, mistakenly reverses this logic. The structure of the fallacy is as follows: if P, then Q. Q is true. Therefore, P must be true. This is fallacious because there could be other reasons, R, S, T, etc., that could also lead to Q being true. Let's break down what the affirmation of the consequent means with a simple examples. Example 1. If I am in Paris A, then I am in France B. I am in France B. Therefore, I must be in Paris A. This is a fallacy because being in France does not necessarily mean one is in Paris. One could be in any number of other cities in France. Example 2. If it is raining A, the ground will be wet B. The ground is wet B. Therefore, it is raining A. This reasoning is fallacious because there are other reasons the ground could be wet, such as a sprinkler system or someone washing a car. Example 3. If my computer is turned on A, the power light will be on B. The power light is on B. Therefore, my computer must be turned on A. This is incorrect because the power light could be on for other reasons, such as the computer being in sleep mode or a malfunction, causing the light to remain on even when the computer is off. Why it matters? Applying the concept of affirmation of the consequent within applied behavior analysis requires a bit of contextual adaptation, as ABA focuses on the empirical study and modification of behavior. In the context of ABA, the fallacy of affirmation of the consequent can manifest in reasoning about the causes of behaviors, or the effectiveness of interventions based solely on observed outcomes, without considering alternative explanations. Why it matters? Fallacy of affirmation of the consequent. Example 1. Behavior reinforcement. If a specific reinforcement strategy A is applied, then an increase in desired behavior B is expected. An increase in the desired behavior B is observed. Therefore, the specific reinforcement strategy A must be the cause of the increase in desired behavior. Fallacy explanation. This conclusion might be fallacious because the increase in behavior could be due to other factors. Example, changes in the environment, maturation, or the effects of other intervention that coincidentally occurred alongside the application of the reinforcement strategy. Example 2. Implementation of a behavioral intervention. If a new behavioral intervention A is effective, then we will see a reduction in challenging behaviors B. A reduction in challenging behaviors B is observed. Therefore, the new behavioral intervention A must be effective. Fallacy explanation. This reasoning is fallacious, without considering other variables that might have contributed to the reduction in challenging behaviors, such as changes in medication, natural fluctuations in behavior, or other concurrent interventions. Example 3. Use of a communication device. If a child learns to use a communication device A, then the child will show improved social interactions B. Improved social interactions B are observed. Therefore, the use of the communication device A must have led to improved social interactions. Fallacy explanation. This conclusion may overlook other factors that could contribute to improved social interactions, such as parallel social skills training, changes in the child's environment that encourage social interaction, or even developmental progress unrelated to the communication device. Importance in ABA. Understanding and avoiding the affirmation of the consequent fallacy is crucial in ABA. For several reasons. It ensures that interventions are based on solid, empirical evidence of efficacy. It prevents the allocation of resources to interventions that may not be genuinely effective. It upholds the ethical standards of ABA practice by ensuring that only scientifically validated methods are used in treatment. To avoid falling into the trap of affirmation of the consequent in ABA, practitioners should use controlled experiments or single-subject designs to more clearly establish cause and effect relationships. Consider multiple hypotheses and alternative explanations for observed changes in behavior. Collect data across different conditions and over time to differentiate between the effects of specific interventions and other variables. 1. Use controlled experimental designs. Implement controlled experiments where participants are randomly assigned to treatment and control groups. This helps establish a cause and effect relationship between the intervention and the outcome. In ABA, single subject designs can serve a similar purpose by allowing practitioners to observe how behavior changes in response to the introduction, removal, or alteration of interventions over time. 2. Multiple baseline designs. Employ multiple baseline designs across behaviors, settings, or subjects to demonstrate that changes in behavior are directly attributable to the intervention and not to external factors. This involves implementing the intervention at staggered intervals across different contexts or individuals and observing the effects independently. 3. Functional behavior assessments. Conduct functional behavior assessments to identify the antecedents and consequences that maintain a behavior. By understanding the function of a behavior, interventions can be tailored specifically to address these factors, reducing the likelihood of attributing behavior change to the wrong causes. 4. Data collection and analysis. Collect and analyze data continuously throughout the intervention process. This includes baseline data, intervention data, and follow-up data. Use visual analysis and, when appropriate, statistical methods to determine whether changes in behavior can be reliably attributed to the intervention. 5. Consider alternative explanations. Always consider and systematically rule out alternative explanations for observed behavior changes. This might involve examining environmental changes, variations in the individual's physical or emotional state, or other interventions occurring concurrently. 6. Replication. Replicate findings across different participants, settings, and behaviors to confirm that results are consistent and not due to specific circumstances or coincidences. Replication strengthens the evidence for the effectiveness of an intervention. 7. Peer review and collaboration. Engage in peer review and collaboration with other professionals to gain insights and feedback on intervention plans and interpretations of data. This can help identify potential biases or overlooked alternative explanations for behavior change. 8. Training and education. Continuously seek training and education on research methodologies and critical thinking. Understanding the common pitfalls in reasoning, such as the affirmation of the consequent fallacy, can help practitioners avoid these errors in their work. 9. Ethical consideration. Adhere strictly to ethical guidelines that stress the importance of evidence-based practice. This includes being open to changing or discontinuing an intervention if the data do not support its effectiveness. Let's practice with some mock exams. Mock Exam 1. An ABA therapist introduced a reward system to increase homework completion in a student with ADHD. Over the next month, the student's homework completion rates improved. Which of the following best illustrates the fallacy of affirmation of the consequent based on the scenario above? 1. Since the student's homework completion improved after the reward system was introduced, the reward system must be effective for all students with ADHD. 2. The reward system is effective because it is based on principles of positive reinforcement, which are well established in psychological research. 3. Other factors, such as changes in the student's medication or parental involvement, could also explain the improvement in homework completion. 4. The improvement in homework completion rates confirms that reward systems are a necessary intervention for students with ADHD. Correct answer is 1. Since the student's homework completion improved after the reward system was introduced, the reward system must be effective for all students with ADHD. Choice 1 commits the fallacy of affirmation of the consequent by assuming that the reward system is the sole and effective cause of the observed improvement, without considering other possible explanations or the variability in individual responses. 2. The reward system is effective because it is based on principles of positive reinforcement, which are well established in psychological research. This choice is incorrect because it justifies the effectiveness of the reward system on theoretical grounds, rather than empirical evidence specific to the scenario. It doesn't directly relate to the fallacy of affirmation of the consequent, which involves drawing incorrect causal conclusions from observed outcomes. 3. Other factors, such as changes in the student's medication or parental involvement, could also explain the improvement in homework completion. This option is actually correct in the context of avoiding the fallacy of affirmation of the consequent, as it points out the necessity of considering alternative explanations for the observed outcome. 4. The improvement in homework completion rates confirms that reward systems are a necessary intervention for students with ADHD. This choice wrongly assumes that the observed improvement in a single case can be generalized to all students with ADHD, which is an overextension and not directly related to the logical structure of the fallacy of affirmation of the consequent. It's more about generalization than causation. Mock Exam 2. After implementing a sensory integration therapy in a classroom setting, a teacher notices a reduction in disruptive behaviors among students with autism. How can the teacher avoid the fallacy of affirmation of the consequent? In evaluating the effectiveness of sensory integration therapy? 1. By attributing the reduction in disruptive behaviors solely to sensory integration therapy, without considering other concurrent changes. 2. By conducting a controlled study where some students receive sensory integration therapy, while others do not, and then comparing the outcomes. 3. By assuming that sensory integration therapy will be equally effective in all classrooms based on these results. 4. By continuing the therapy indefinitely without further assessment of its impact on disruptive behaviors. Correct answer is 2. By conducting a controlled study where some students receive sensory integration therapy, while others do not, and then comparing the outcomes. 1. By attributing the reduction in disruptive behaviors solely to sensory integration therapy, without considering other concurrent changes. This choice is a direct example of the affirmation of the consequent fallacy. It assumes that because the desired outcome was achieved, the therapy must be the cause, without considering other factors that might have contributed to the change. 3. By assuming that sensory integration therapy will be equally effective in all classrooms based on these results. This option suggests a generalization from a single observation to all similar contexts, which is a different issue from the fallacy of affirmation of the consequent. It's more related to the problem of overgeneralization. 4. By continuing the therapy indefinitely without further assessment of its impact on disruptive behaviors. Continuation without reassessment fails to address the fallacy directly. It's more about a lack of ongoing evaluation than about incorrectly inferring causality from a single outcome. Mock Exam 3. A study finds that children who participate in a specific A-B-A program show significant improvements in social skills compared to those who do not. Which conclusion about the A-B-A program avoids the fallacy of affirmation of the consequent? 1. The improvements in social skills are directly caused by the A-B-A program, proving its effectiveness. 2. Since the children in the A-B-A program improved, the program is the only effective method for teaching social skills. 3. The ABA program may contribute to improving social skills, but further research is needed to rule out other contributing factors. 4. The presence of social skill improvement in children confirms that the ABA program should be the standard for all children. Correct answer is 3. The ABA program may contribute to improving social skills, but further research is needed to rule out other contributing factors. Choice 3 avoids the fallacy by recognizing the potential contribution of the ABA program, while also acknowledging the need for further investigation to establish causality and rule out other factors. 1. The improvements in social skills are directly caused by the ABA program, proving its effectiveness. This choice asserts a direct causal relationship without acknowledging the possibility of other contributing factors, embodying the fallacy of affirmation of the consequent by taking the outcome to directly validate the cause. 2. Since the children in the ABA program improved, the program is the only effective method for teaching social skills. This is an incorrect choice because it assumes exclusivity in effectiveness, suggesting that no other methods could produce similar improvements. It goes beyond the affirmation of the consequent by also implying a false dilemma. 4. The presence of social skill improvement in children confirms that the ABA program should be the standard for all children. This choice incorrectly generalizes the effectiveness of the program to all children, which is more about inappropriate generalization than the specific logical fallacy of affirmation of the consequent. Mock Exam 4. An intervention to reduce yelling episodes in a child with behavioral challenges involves both a new communication training program and a change in diet. Which approach best avoids the fallacy of affirmation of the consequent when assessing the intervention's success? 1. Assuming the reduction in yelling episodes is solely due to the communication training program, because it was the primary focus of the intervention. 2. Concluding that the change in diet should be applied to all children with similar behavioral challenges, given the observed reduction in yelling episodes. 3. Evaluating the effects of the communication training program and the change in diet separately to determine their individual contributions to the observed outcome. 4. Crediting the entire success of the intervention to the child's natural maturation over the period, without considering the specific contributions of the intervention components. Correct answer is C. Evaluating the effects of the communication training program and the change in diet separately to determine their individual contributions to the observed outcome. Choice 3 demonstrates an approach that avoids the fallacy by seeking to isolate and assess the impact of each component of the intervention separately, rather than attributing the outcome to one factor without evidence. 1. Assuming the reduction in yelling episodes is solely due to the communication training program, because it was the primary focus of the intervention. This choice exemplifies the fallacy of affirmation of the consequent by attributing the success of the intervention to one aspect without considering the potential impact of other components. It's incorrect because it simplifies the causality. 2. Concluding that the change in diet should be applied to all children with similar behavioral challenges, given the observed reduction in yelling episodes. This option makes an unwarranted generalization based on the outcome, suggesting that the diet change alone should be recommended for all similar cases. It's more about overgeneralization than the specific logical fallacy. 4. Crediting the entire success of the intervention to the child's natural maturation over the period, without considering the specific contributions of the intervention components. While ignoring the contributions of the intervention components is problematic, this choice does not directly relate to the fallacy of affirmation of the consequent. Instead, it suggests an alternative explanation: maturation, without examining the actual cause-effect relationship between the intervention and the outcome. That's all today. I hope you understand better about affirmation of the consequent. If you like this video, please hit the like button and subscribe the channel. Thank you for watching.